Project CARE is a federally funded grant project that works with some monies from the Elementary and Secondary School Guidance Program in Washington. And we're providing 4 extra school counselors in selected sites around Richland Two. We also have, in addition to those 4 counselors, we have one person who's a bilingual mental health professional, and she works in selected schools, and a 6th staff member who is a social worker in a couple of other schools.
Project CARE began in Richland Two in 2010 with the goals of reducing discipline issues in our schools and to offer more support to our English as a second language families and our military families.
The project was written really to reduce discipline concerns, and that with the belief that increasing school counseling services would be one way of addressing the needs of some of those students who get into discipline concerns. So the schools were chosen by looking at the needs that they had in those sites with the bilingual populations, the military population, and the number of discipline concerns. So it wasn't just the sites that have high discipline concerns, it really was a multi-factor thing.
This project was structured with community involvement in mind. The team effort includes a council made up of community members, parents, university staff, the Richland County Sheriff's Department, Fort Jackson, mental health professionals, and district staff.
For our counselors, they see how important their work is. They see those people coming to hear about their work, and that just drives them to do more work when they go back. But it also gives them feedback about whether their work is really heading in the right direction. And I think the school reflects the community. The school is a piece of the community. The school is tied in with the community. If we don't seek them out, we really miss out on something. We're losing a big piece.
The majority of people are involved in the school system, and I am in the community. I'm a psychologist and I've worked with children, and so my role is more as an outside perspective. Do I have anything to contribute in terms of how the project is organized, or any suggestions, any other kind of input as an outside person?
Project CARE is a program that helps with the discipline, helps keep these kids on the right track, and any kind of program like that we want to be part of, so we're honored to be part of this program. And one of the things that made Project CARE so attractive to us and want us to get involved in is that it's all-encompassing. It's just not one area. If there's a mental health issue, if there's a family issue, if there's a substance abuse, whatever the issue is, they don't pass it on to someone else. They find the answer and they work with the family and work with that person and try to find a solution. Again, we want that young person to stay in school. We want that person to get a good education, and you have to look at all areas. It's just not one thing that prevents that from happening. So that's what Project CARE does. It looks at everything.
We all are able to come together, principals from other schools, community members. We have the Sheriff's Department. I mean, there is so many people that want a piece of Project CARE, that need a piece of Project CARE, so that we can continue to care.
Project CARE uses a multitude of strategies to serve the students and their families, including small group counseling, family counseling, and the Building Bridges initiative.
One of the things for a counselor's role is that they're part of their job is to do a lot of small groups for students. For instance, maybe students who are grieving the loss of a parent or loss of a grandparent, or students who have parents in the military and they're overseas. Also students who are just struggling with how to make friends or how to socialize. With one school counselor, that was very difficult to get to. She was also doing classroom guidance plus helping students with academics. And so for him, the second counselor, to come in and provide those small groups, we have more small groups than we've ever had. And so between having 2 counselors, it has made such a difference as far as academics. Also just for students feeling like they have someone they can go to quickly and immediately. And teachers, they now have a second person who they can call if the student, instead of having to write a student up, they may call the counselor. We just talk to the student about this, and it can solve so many problems so quickly.
Condor has such a diverse population of working and non-working parents, military families, English, non-English speaking families, and it has been a challenge to be able to meet and work with those parents. Because the care counselor has flexible work hours, she has been able to meet the parents after traditional school hours, and that has been tremendous. She has provided parenting classes, she's done home visits, she's done family meetings with them, and we have seen a difference in the relationship with the parents and the students, as well as the achievement of the students. Even parents come in and talk about the strategies that they are using that they got from the care counselor.
One of the things that we do in the project is we use a multi-family group format, which was developed by some folks in Intervention Services in Richland Two. It's called Building Bridges to Success. And the multi-family group format allows families to come together and learn about working with other people, improving communication skills. And we've increased the number of families who can participate in building bridges through the CARE project. The feedback from them has been very, very positive. It teaches problem-solving skills, teaches families how to get along with each other in a non-threatening kind of environment.
And you can really see a difference in those families that have completed the program from beginning to end, all 6 sessions with the community service, you know. And at the end, when we had our graduation ceremony, not only were the children, you know, able to show a difference, but the parents that didn't want to be there to begin with, they're breaking down emotionally, and they're like, you know, I didn't want to come at first, but this was exactly what we needed.
Through the use of a bilingual counselor, this project has offered support to our growing Hispanic community.
This is a lifeline for a lot of families, and that language makes all the difference in the world. When people tell their stories, they want to tell it in their own language, especially the adults. It just flows, you know, and again, we want the parents involved, we want them to trust us and to believe in us, and the language, I think, you know, makes that difference. He said that he learned quite a bit in the program in terms of how to relate to his child, how to communicate with her, information about drugs and alcohol, and just to keep that communication open between them and the children. And he said that was very helpful to him. Again, thanks to the district for offering this in our language where we can understand it, because otherwise we might get confused about what's being said and misunderstand some things, but for it to be offered in Spanish was very helpful to him. Yeah, it's very important because sometimes as parents we have problems with our children, but because of the language barrier, we don't want to enroll. So with that being out of the way, the door's open.
The partnership between Fort Jackson and Richland Two has always been important. Through Project CARE, the district is able to offer expanded services to our military families that deal with issues that most families don't have to face.
Well, because our military population is highly transitional, I believe that the Project CARE grant is beneficial to our families. Reason is because our students move in and out all of the time, and they need that extra resource in order to make them feel comfortable so that their transitions are seamless. So we feel that this Project CARE grant is quite beneficial to these students as well as others, but more specifically with our military-connected students, we believe that this program is beneficial.
That's been very positive. The Fort Liaison serves on our advisory council. She's there for every meeting giving advice about the military families. You know, we have some of the schools that are really close to Fort Jackson are recipient schools of the services provided by Project CARE.
One of the groups was for students parents who are in the military. We began to see some immediately and quick benefits of those students being able to talk together. Plus, it really helped us at school to realize how many military families we have. We've always kind of known we have a lot, but really seeing these groups together and seeing these students, it's just really helped us. Plus, we also know if we see a student acting out, we may realize it could be because of the fact they really are just missing their mom or dad who's overseas.
The program focuses on the identification of issues and the intervention to solve these issues at an early age to help students develop the skills needed to be successful throughout their education and adult life.
I mean, it bridges that gap because what happens is you have a party that doesn't have the same view as the person that's inside the classroom, and then the view of the kid or the student. So now you got a person that's neutral versus those other two entities. What then happens? You start to bring that together, to start saying, okay, what do we need to do differently? How do we need to interact or interject? What do we need to put in place? Then you bring the parents in. So now everybody's working together. Now you have a community within the school system, when a lot of times that's what's missing. And I have to say, even for Trey, from what I've seen this past year, that was what was necessary. Okay, even though mom is screaming on one side, you know, you got the school screaming over here, but then we got Ms. Butler screaming over here. So, I mean, you know, we had everybody able to do what? Come together and say, okay, we got to put out a fire. Now, what can we do to put out a fire? Even though we all had frustrations, but we all came together to do what? Make sure that he got what he needed.
That early intervention is so important in helping the students to develop those essential skills. And at Conner, we say that we are dealing with the whole child. We try to address all the needs of the students, the academic needs as well as the social, emotional needs of the students. So the earlier you start, I believe, is better.
We believe in intervention. We believe in being very proactive, and that's what this program is all about, being proactive to make sure that we reach these kids at an early age and get them on the right track.
I also believe that the younger that we get these students and the younger that we're able to provide them with the necessary strategies in order to make sound decisions and how to handle certain situations, the better they'll be in middle school, high school, and even in life.
The Project Care program is a grant-funded program, but when the grant ends, the need for these services will remain. The families, staff, and community members involved in this program strive to continue to offer the services and help to our Richland Two students and families.
At the end of the day, there are kids that's even in the schools themselves that would benefit just by having it there. So if it's not there, we got some problems. I can see that.
If a program like this was not around, we would see that some of our military children would not get those necessary resources that they need in order to vet their issues with a professional adult. Someone that will be able to assist them as they transition, or someone who will be able to listen to them attentively and be able to follow through with them. We are hoping that this grant will be able to sustain itself as well and provide the necessary issues and necessary things that our children need.
Very important, he thinks, that the district continues offering these services so that we can continue to help our children, and as parents we can cooperate with what's offered.
I really want to work with the district to come up with a way for us to continue these services to our students, because really, the bottom line is really all about meeting the needs of our students, and having this second counselor in place has really benefited our students. So I can't imagine doing without it now.
Project Care, in my eyes, is not just like a grant. Project Care, and I know the other care counselors often have heard me say this, is a movement. This is a movement. This is something people need to catch on and keep going, because if you take away the multifamily portion, well, the good that it did those families, you're not offering that to anyone else. You know, the amount of counseling that you're able to offer on an individual small group basis with the children that really need it, that the school counselors like myself now don't necessarily have the time with a caseload of 400 or 500 kids to do. It's not that you don't have the heart to do it, it's just that you don't have 14 clones of yourself to really be effective. Project Care is a necessity.